Welcome to Fibromyalgia Association Canada's International Fibromyalgia Awareness Day event. Before I introduce myself and my colleagues and our guests, I would like to do a land acknowledgement. In Canada, we live, learn, and work on traditional Indigenous territories. We pay our respect to the First Nations, Métis, and Inuit ancestors and affirm our commitment to respectful relationship with one another and this land. I am making this land acknowledgement from Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq people. We are all treaty people. My name is Trudy Flynn, and I am chair of the Fibromyalgia Association Canada. I have lived with fibromyalgia for 30 years and have been a caregiver to my daughter who developed fibromyalgia at the age of 8. I have been doing advocacy work for fibromyalgia since 2009. I'm currently a patient engagement research ambassador at the Canadian Institute of Health Research's Institute of Musculoskeletal Health and Arthritis, representing people with fibromyalgia. And I am a patient partner at the Maritime SPORE Support Unit and sit on 2 of their governing bodies, also representing people with fibromyalgia. Fibromyalgia Association Canada, or FAC, is a group of like-minded people who came together just over a year ago and decided that Canada needed a national fibromyalgia association. Our purpose is to make fibromyalgia visible and raise awareness to our friends, our families, our doctors, our politicians, our insurance and disability programs, and everyone else who deals with people with fibromyalgia across Canada and elsewhere. FAC wants to educate those with fibromyalgia and those who don't have fibromyalgia. We want to promote research that is currently taking place and advocate for research that needs to be taking place. FAC is a federally incorporated not-for-profit. For those of you who might find it difficult to sit for long periods, I would just like to mention that this event is being recorded so it can be made available at a later date on FAC's YouTube channel, Dr. Furlan's YouTube channel, and the FAC website. Our moderators today will be Maggie O'Brien and Salima Andoni. Maggie is a police officer on medical leave and is the treasurer on the board of directors of Fibromyalgia Association Canada. She is a strong patient advocate and a public speaker. Salima is the clinical social worker, expressive art therapist, and trauma responsive therapist. Salima is on the board of directors of Fibromyalgia Association Canada. Our guest today is Dr. Andrea Furlan. Dr. Furlan is a physician specialist in physical medicine and rehabilitation, physiatry. She is a physician in the pain clinic at Toronto Rehab Institute, which is part of UHN. She is a senior scientist at UHN and associate professor of medicine at the University of Toronto. She is chair of ECHO Ontario Chronic Pain and Opioid Stewardship, which aims to educate primary care professionals about chronic pain and is funded by the Ontario Ministry of Health. In 2019, Dr. Furlan started a YouTube channel to teach her own patients about chronic pain, and the channel has grown to 380,000 subscribers and has had more than 31 million views. Dr. Furlan has received too many awards for me to name here, but a few are in 2020, she received the Pain Excellence Award by the Pain Society of Alberta, and she was the recipient of the 2021 Canadian Pain Society's Excellence in Pain Mentorship Award. On March 14th, Dr. Furlan was named the top doctor in pain management by Post City magazine. And just this past week, Dr. Furlan received the Dr. Gail Fasula Award in recognition of her excellence as a clinical teacher in the pain medicine residency program. Without further ado, let's get to the question and answer session of our event.
Thank you very much for that introduction, Trudy, and that very nice warm welcome to everyone that's joining us today on Facebook Live, to our audience, and to Dr. Andrea Furlan. I'd like to begin with the questions now. Dr. Furlan, it often takes years for actual patients to get diagnosed. How would you recommend a person with symptoms of fibromyalgia get a diagnosis in a timely manner?
Yeah, thank you, Salima, for the question. And thank you for inviting me to be here. I really feel this is so important. Thank you for doing this, this educational outreach. And Salima, I think the answer to that question is exactly what you were doing here, is education. It is outreach. It is talking to the public, the general public. I don't have a magic solution how people with fibromyalgia can get the diagnosis earlier. Ideally, as soon as a person starts having pain that is spreading to their body, feeling fatigue and poor concentration, someone should be thinking, I think this person is developing fibromyalgia. But they don't. They never think about fibromyalgia until it's a full-blown fibromyalgia. And we know fibromyalgia doesn't start like that with all those symptoms. It starts slowly. And we need to bring education about fibromyalgia to not only medical schools and medical residency, but I think to high school and middle school. One of my dreams is, before I die, would be to include in the middle school curriculum, grade 5 or 6, some lectures in the biology class about pain. My kids, when they were in grade 5, they had to do projects. They had to explain the immunological system, the digestive system, respiratory system, reproductive system. I asked them, where is the pain system? Did you learn about the pain system? No. I think that's where we need to include education in grade 5 or 6. Tell people that we have a pain system, and one of the conditions that affect the pain system could be fibromyalgia. Here are the symptoms, and because it's going to affect a lot of people. It's not a rare disease, it's common. And then it's like diabetes. I think the general population knows if you start drinking too much water, you're too thirsty, and you're peeing too much, maybe you're having diabetes, and go to the doctor and get your blood test done. How does the public know that? But they don't know the symptoms of fibromyalgia. So I think that would be a solution, but I don't know how to get there.
Well, that's really good information to bring back the education and bring it to more of a common level. To follow up on Salima's question, Dr. Furlan, would you recommend people with fibro fight the stigma that surrounds the diagnosis, like from our own doctors, our employers, our coworkers, family members, friends, but mostly emergency departments where we do find a lot of difficulty? What would you recommend?
Oh dear, yes. And I am here in Montreal at the Canadian Pain Conference, and I was just having lunch with a physician. She's here, she's an emergency physician, and she's learning about pain, and she's working in a pain clinic. And I was telling her about this interview, and she said, this is so true, especially in emergency, that when we see a person like this complaining of pain, and we see in the chart, this person has history of fibromyalgia, that's so scary to us. And I would say, I always tend to see the good side of people. I never imagine that they are doing this because they're bad or they have bad intentions. I always try to see the good side of their hearts. When they see someone with all those complaints and in many body parts, and they know they only have 5 minutes to examine, talking to a person like this, they feel they don't want to make a mistake. They don't want to miss something that is serious. They don't want to cause more harm. They don't know what to say. They don't even know much about fibromyalgia. So they're afraid. A lot of physicians are afraid of their lack of knowledge. They realize they have a lack of competence in this area. And, you know, when you don't feel competent to do something, you kind of avoid that situation. And the way to avoid is, she was telling me that there are physicians who refuse to see patients with fibromyalgia, primary care doctors, they don't accept, because people with fibromyalgia, especially the ones who are decompensated, they have a lot of symptoms, nobody gave them a plan, they are very complex and very demanding. I'm not afraid of them because that's what I do for a living, but I can imagine why physicians and some healthcare professionals are, because they don't have the right competences to do that. And that's scary. That's scary. You need to understand that they don't want to cause more damage and more harm, but sometimes they are. Just by refusing to listen, that's already a harmful attitude. I think the best thing is just listen and learn together. And if you say, I don't know much about this disease, but I'm willing to learn and let's learn together, that I don't think there's anything wrong with that. But a lot of people are also, they have their pride and they don't want to, recognize that they have this lack of knowledge. And so the education of medical professionals is another thing that I'm doing a lot, trying to break that barrier that they have, not only with fibromyalgia, but any kind of chronic pain. They don't know what to do, and educating healthcare professionals is one of my tasks, another one that I want to achieve before I die.
Well, thank you very much. I appreciate it. Salima?
I really appreciate that you mentioned just now that when you're in the ER and the medical professionals are not really receptive, in not taking action, they actually are doing harm also, by turning away people. The question I have for you is, when we finally do get diagnosed, we're often kind of left to our own to navigate the labyrinth of the medical system and to find our own care plans. Do you have any suggestions on what would make it easier, or what our next steps could be in creating a care plan?
I do. Become a member of FAC. I'm not joking. I'm not joking. I think, just having a group of people who had navigated the system, had more experience, and can guide them in their early journey. Because again, Salim, I don't have time to do this for my patients. Unfortunately, I feel so bad that sometimes I spent an hour taking their history, all of the details, and then another 10, 15 minutes examining them. And then after this, an hour and a half, I made the conclusion, this is fibromyalgia. But I need that 1 hour of talking, 20 minutes examining. And now I have only, my next patient is waiting. And I only have 5 minutes to give the news. You have fibromyalgia. I think that's what you have. And then I kind of, okay, go. And where do I send them? Because a lot of physiotherapy clinics, and it's hard for them to find a physiotherapist that even understands what is fibromyalgia, or a lot of social workers may help. Psychologists is almost impossible to get for my patients. Forget about psychology, it's impossible. But that's another thing. So then instead of abandoning them and say, okay, I'll see you again in 3 months, follow up, I need to give them something. I need to give them what now, right? Giving the diagnosis is not enough. So I'm so happy that now I have the website, and I think I'm going to print a postcard, because I tell them, did you know that there are other people who have this diagnosis and they can guide you? They have resources, they do events, and they can talk to you. This is so, the patients, they open their eyes and they say, really, I can talk to other people who have this diagnosis, they can guide me. It's really important because it's hard to have this diagnosis, and then you go on Google and who knows what you're going to find on Google. You may find good resources, but there are not some healthy groups out there that would have positive messages and solutions. They may be just talking about the problems. And I think having a healthcare team that understands what the problem is, if you can have a nurse that you can contact. Sometimes you can't contact the doctor, we are busy, but try to find who else at your doctor's clinic is available. A pharmacist can be super helpful. A nurse can be very helpful. A social worker, you don't need to be talking to the doctor all the time. These professionals are amazing. And having a group like this is another great resource.
Thank you, Dr. Furlan. On that note, when you have fibro now, we're no longer really seeing the rheumatologists. We're seeing our GPs, our general practitioners, to be treated. And that's like the common understanding that we have right now. Some GPs may not really be completely in the know with fibro, and we understand that. We also understand that everybody is extremely busy and backed up post-COVID. But do you have any suggestions when we are dealing with our general practitioner, specifically about fibro, and how to engage them to get a better treatment plan, or like anything that we should really think about to kind of impact our care plans better?
Yeah, I would say, Margaret, this is a great question. This is so important because you need a partner in your healthcare. You need an advocate that will be there for you. And again, it doesn't need to be the GP. It can be someone who works with that GP. Sometimes it's the nurse or your local pharmacist. Find who is that healthcare professional that you connect best. And if they don't have all the information about fibromyalgia, I don't think there's anything wrong that you offer them to say, okay, I learned about this. Can I provide you with this information? There is this link, there is this workshop, there is this lecture, this seminar, or this book, and tell them this exists. I really appreciate, I get a lot of my patients that they bring me. I had a lovely patient, she gifts me with books, and she said, I think you need to read this book, Dr. Furlan. And I really read. And one of the books that she gave me many years ago was by Dr. Norman Deutsch, The Brain That Changes Itself. And I had never heard about him. And I discovered that he's a psychiatrist at U of T. And that was an eye opener for me. I really love that book. It's amazing. And it was a patient who gave that to me, and she presented me and she said, I think you need to read this book. So I don't get offended if the patients come and they want to teach me about new tricks. But some professionals, they may get a little offended. I don't know. They may feel that you are threatening that they are incompetent or telling them that they don't know much. So you really need the same way that you want to be treated with respect. I think the physicians and professionals, we need to treat patients as people. You're not just a fibromyalgia case. You're a person there that has fibromyalgia, and you're a person. And you also need to respect the person who is on this side of the table. We are also humans, and we also have our emotions. We may get a little angry and nervous. That's fine. And we can apologize. We can become friends. But this conversation doesn't need to be, it's not impossible. You're not there in the office, the medical office, just to receive the information. You're there to have a conversation, a fruitful conversation. Both sides can learn from each other. If your healthcare professional is not open to learn after you tried maybe if possible, try to get someone else that will be more open. But because maybe if you try, and they're still closed, they're not open to learn, maybe it's time to try to find someone else.
Thank you. I appreciate it.
Dr. Furlan, earlier when you were talking, you did mention about, when I asked about navigating the medical system, you mentioned about the care team, and you did mention like pharmacists, nurses. FAC is actually in the process of developing some tools for members. We have developed an emergency fibromyalgia health card that people can download, and we're working on a treatment plan that can be printed out and filled out, and a FAC fibro journal. But what we're wondering is, how would someone with fibromyalgia go about creating a care team and a treatment plan? Are there any kind of things that you would recommend? Like physician's assistants and like social workers? What kinds of questions would they ask of them to know that they, in fact, have knowledge about fibromyalgia?
Yeah, Salima, that's such an important question. I think because fibromyalgia is not taught in regular healthcare schools. In the University of Toronto now, over the last 10 years, we have this pain week that we teach all of these professions about chronic pain, acute pain, and medication. So they have a little bit of a teaching on fibromyalgia, and hopefully they will remember when they start practicing. But as you said, how do you navigate, how you devise this care plan with your healthcare professional? Again, I think learning together and showing those resources to them, and maybe bringing, print these materials, bring to your appointment next time and say, here, I downloaded this from the Fibromyalgia Association of Canada website. What do you think of this? Do you think this works for me? Because you talk about, I think that's lovely. Like you talk about what to do if you have a flare. How do you talk about your pain? What are the systems that can be affected? What to do if you can't sleep well? So, for example, if a patient with fibromyalgia go to a pharmacist and say, for 1 week, I'm not sleeping well, and I feel totally fatigued during the day, but as soon as I get to the bed at night, I'm awake and I can't sleep. That's a very common complaint that we see from people with fibromyalgia. Like a pharmacist can take a look at your care plan and say, okay, but did you try this? Did you do this? What about a hot, there's a couple of things that you can try. And if you need an over-the-counter medication, they can help. And if you need a prescription medication, they can get in contact with the physician, say, I need a prescription for this. This patient is not sleeping for a week. We need to do something today. Regulate their sleep again, and and I can monitor this patient, will not be using this medication forever. We will monitor this for maybe 10 days. That's the kind of conversation that is very healthy, because sometimes a patient with fibromyalgia needs a benzodiazepine for 5 days so they can regulate their sleep and then go back on their journey. And a pharmacist can be the intermediary to get that prescription, monitor, and help with the other symptoms that come with fibromyalgia, like the fatigue. Sometimes you need an investigation. Maybe you need to do a blood test to see if you're not anemic, if your thyroid is okay. And then if you talk to the nurse, like the nurse in the clinic, if you say to the nurse, I'm getting this fatigue, I think it's part of the fibromyalgia. But then the nurse will say, when was the last time that you tested to see if you don't have anemia or your thyroid? Maybe 5 years ago. It's time for you to test again. I'll go talk to the doctor, get the medical requisition, and you go to the lab tomorrow. So this is the kind of plan, okay? This is the kind of care plan that we need to have. And sometimes just relying on the doctor, you're going to get the appointment. Who knows when you're going to get the appointment to see your doctor, maybe too late. I hope that helps.
Mhm.
I don't know if I forgot the original question. I get distracted and I.
Okay.
Actually, I thought, yeah, you answered that very well, and by bringing in holistic treatment from all different aspects. And that's what we actually would like to develop, is a treatment plan that's a handout, and that we can all work together with our care teams to fill in. So with advice with that treatment plan in mind, if you're in a severe fibro flare, what would you recommend to do if for that treatment plan as an immediate, like you suggested with the sleeping? If someone was overcome, at basically pushed to their limit, and besides going to the ER where we really do get written off, and we're not trying to be argumentative or difficult, but you don't really want to get kind of gaslit, but we want to not go to the ER. We want to be able to take care of ourselves better. What would you recommend if you were in a severe fibro flare? How would you do an intervention that we could start like taking care of ourselves better?
Yeah. I really appreciate that you're doing this, and your fibro flare toolkit that you developed is amazing. It's really good. It's a little overwhelming. I don't know. It's a lot of information there, and I hope people have time to digest. I would say, okay, a few things I have here, Margaret, for this question. First is I find that when a person is in the middle of a flare, their ability to make decisions, to concentrate and to remember things is lower. If they can find someone, family, a friend, or a healthcare professional that will help them to make decisions, that can help. Because when you're tired, you make mistakes and you rush for the quick fixes. I find this when I'm tired, I eat the most garbage junk food. And I know it doesn't make sense, but I don't want to think, and I am stressed, and that's exactly the type of food that I don't need at that time, right? So you make the poor decisions. Like never go to the supermarket grocery shopping when you're hungry, because you're going to shop and buy the worst things. But that's the same thing. When you're in a flare, you're not going to make the best decisions just because you can't think, you're tired. So if you have, when you are not flaring, when your brain is thinking more clearly, maybe that's the time that you have to think about what are the things that worked for me in the past, make a list and put them in a very clear place inside of your wallet or your purse or your bathroom, a place that you're going to see. We help people who have suicidal tendency. We tell them this, exactly this. When they're thinking about suicidal, we tell them that's not the right time for you to make decisions. So get your paper, because they have a plan. They have an escape plan that they wrote when they were not thinking about suicide. And then they read that plan, and then they make the right decisions. So if you can make that plan for you, write down the things that worked for you in the past flares. So then you can remember, okay, oh, I didn't try this. Maybe if I go in the bathtub and I immerse myself in the bathtub with a lot of Epsom salt for 1 hour, that flare will be improved, and then you'll be able to think normal again. Or, take your vitamin, go for a walk, take your dog out, go gardening. So there's so many things, like a list of things that you can do that worked for you in the past. So make that list visible. The other thing is have someone that you can call or email or text, because if you are alone and you are thinking inside of your head with yourself, the same thoughts come inside of your mind and you can't think clearly. So if you have someone that you can call, text, message, someone that you trust, and say, I'm having this, and what do you think? Maybe that person will help you to see some escape that you are not seeing right now. The other thing is try to, I know that's easy for me to say, but it's not easy to do. Try to keep your life as normal as possible. I tell my patients, when you're having a flare, try not to be in bed all the time, because you will lose all the fitness and the condition of your body that you worked so hard to achieve. So for example, if we're trying to build up your exercise levels, tolerance to exercise, and you were able to reach such level, now you have a flare for some reason, could be a mental stress and anxiety, and then you go to bed for a couple of days, you kind of lose that conditioning that your body had achieved, because we lose much faster than we gain, okay? Or fitness, it takes longer to get and you lose very fast. So try to be physically active, try to distract yourself, your mind out, and remember, it will go away. The same way that the previous flares lasted and they went away, this will go away, will not last forever. And they happen, you need to be used to them, and let your coworkers know that you have this chronic condition. So you need accommodation, you need time for yourself. You have to plan around. I think the most difficult part for patients with fibromyalgia is it's hard for them to make plans, because they never know when they will be feeling good or not so good. So inform people around you that you have a chronic disease, and you have good days and bad days. And yeah, I think that those are my ideas, some suggestions.
Perfect. Thank you. Selena?
Thank you for that. Those are very helpful suggestions. Some of those are things that we were actually considering and putting into the logs that we're creating. What I was hoping that we could kind of pivot to now is, in our conversations, you actually made some reference to your concept of the 5 M's, and we noticed some parallels with our Fibro Flare Kit. And so I was wondering if you could explain your concept of the 5 M's. I think our audience would find that very, very helpful to know what they are.
Yeah. Thank you, Salima, for asking that. That's my way of remembering things. My memory sometimes is, I forget things. And I think it's not just your privilege that have people with fibromyalgia that tend to forget things. Also, so for me to remember, what are the groups of things that my patients with chronic pain can use when they're having a flare of pain or they're having a difficult day. Some people only remember the pills that they have in the medicine cabinet. When they have a pain flare, the only number 1 and number 2, number 3, it's all the medicine cabinet. That's the only thing that they can think of for their pain flare. And I tell them, yeah, it's okay. That's the last M. That's the last M. But there are other medications is the last one. But there are other M's that you can try, and maybe you don't need the medication. I'm not against medications. Okay, I'm very friend and fond of medications. I love giving a prescription. Don't take me wrong, but they have side effects, and they affect other systems. And if we can avoid them, that's better for the patient. So what are the other M's? So the first M that I tell my patients, did you try some movement? I tend to avoid the word exercise, because exercise, they think they have to go to the gym and they have to go to physiotherapy. No, movement, just movement. And why movement? Because we have a lot of evidence that movement is excellent for fibromyalgia. We have a lot of evidence that movement retrains the pain system, which is the origin of the problem with fibromyalgia. We have a lot of evidence that movement is excellent for mood, for improving depression, for improving the oxygenation of tissues, for oxygenation of the brain, so people can think better, and for improving sleep. So it's one thing that it's so many benefits. And so think about movement, and what kind of movement for fibromyalgia? Any movement that you like. Do anything that you like, but move. It could be even in bed, like if you're in bed, bedridden, just do the numbers in the air. So I have one exercise that I tell people with the legs, they draw a number 1, number 2, number 3, number 4. Just draw the number, and then you can do with your arms, number 1, 1, 2, 2. That's lubrication for the joints. Or dancing, doesn't need to be a Zumba class, just go to a, put a slow music and dance. Or go for a walk, or get some weights. Could be like a water bottle, and raise, go up and down with some weights. Go for a pool. Excellent exercise. Hydrotherapy is so amazing. Hydrotherapy has so many benefits for fibromyalgia. Go find a pool, a warm pool, and just walk inside of the water, go back and forth, do some kicks inside of the water, underwater, or do some stretches, go on the floor and stretch, or even do some relaxation exercises. So movement is the first thing that we should think. That's the first M. Second one is mind-body therapies. So those would be things that will relax our stress hormones. So we have the two nervous system, autonomic nervous system, the sympathetic and the parasympathetic. The sympathetic system is the fight, flight, freeze response. The parasympathetic, they oppose each other. When you activate one, you decrease the other one. So the parasympathetic is the rest and digest. When you activate the parasympathetic, you are reducing the adrenaline, cortisol, that are the stress hormones, and then you feel less pain. And how do you activate the parasympathetic nerve system? With a lot of mind-body therapies. This could be meditation, mindfulness, praying, distraction, playing a video game, hypnosis, practicing some things that you learn with cognitive behavior therapy. So those two things, movement and mind, they achieve a lot because they produce endogenous opioids, they activate the endogenous cannabinoid system, they activate the inner pharmacy that we have in our body. No side effects, okay? The third M is something that you can do for yourself, modalities. So I tell my patients, did you try heat? Did you try ice? Did you try pressure, a foam roller? Did you try dance? So modalities that you can apply to your body. The fourth M is manual therapy. You can do self-massage. So I teach some self-massage of the trigger points, but sometimes you need to go to a massage therapist or a chiropractor or physiotherapist. They will do mobilizations, manipulations. And the fifth M is medications. So then you have your medicine cabinet. What is that you have there that you can use in a pain flare or you have to take regularly. So those are my 5 M's, Salima, that I package them so people can remember and have a lot of options when they are in pain.
Thank you. I think that was very, very informative and very, very helpful to our audience. I'd like to bring it back to Trudy, who's the chair of the Fibromyalgia Association of Canada, who's going to now focus our questions on our live Facebook audience. If they have any questions that they would like to put into the chat box or have been putting, we may not have time for all of them, but we'll try to get to as many as we can. Trudy?
Thank you, Salima. So we are taking questions from the audience, like Salima said, and we do apologize if we don't get to your questions. So we have one question from Vivian. Vivian said she would like to know, she's taking Zopicon for sleep, which hasn't been helping, but her neurologist will only prescribe this medication for sleep. She combines it with cannabis, medical cannabis, and it doesn't help. She would like your suggestion of benzodiazepines that that she could actually recommend or take to her GP to see if those would help?
Okay, thank you. Yeah, great question. Unfortunately, I don't know all the situation that Vivian is living and all the other things that she takes, so I can't really make a recommendation for her case because let me just explain. Zopiclone is in the family of benzodiazepines. We consider it a Z drug. So all the Z drugs are in the benzodiazepine class. Zopiclone is in some countries, I don't know which country she is too, if it's Canada or any other country. In some countries, Zopiclone is not considered benzodiazepine because it's considered a safer version of benzodiazepine. But here in Canada, we consider it because it has the same dangers of benzodiazepines. So let me just talk a little bit about Zopiclone because sleep problems is very common among people with fibromyalgia. Very common. They have insomnia at night, fatigue during the day. Sleep study shows that they have some disruptions. So I would say the benzodiazepine family, it's not a good option to treat insomnia. They are really good for anxiety disorders, generalized anxiety disorders. They're excellent for people who have panic attacks, GADs, which is generalized anxiety disorder. These people really need benzodiazepines for a long time, for a long period of time to control their anxiety attacks. So if the person doesn't have anxiety that needs medication, using benzodiazepines just to regulate sleep is not a good option because the person falls asleep very quickly when they take a benzo. But the quality of sleep is terrible. It's one of the worst. When we do the sleep study, they are sleeping, like they are with their eyes closed and quiet, but they're not restoring their body and mind, which is the purpose of sleep. The reason why we sleep is because we need to restore all of the functions of our body, especially the neurotransmitters in our brain. And that doesn't happen when you have benzo. Also, alcohol does the same thing. Alcohol is very similar to benzodiazepines, and a person will fall asleep very quickly, but then they have a terrible quality of sleep at night if they drank alcohol before sleep. So I would say benzodiazepines, if it's needed to regulate sleep just for a few days, not more than 7 days. More than 7 days, the body creates a dependence on that medication. And then it's really hard for the person to sleep again without that pill. It's strong dependence. Their body will not be able to fall asleep without that pill. So we really need to be careful. There are so many other things that are excellent for sleep. And I would leave the benzodiazepines as a last resource.
Thank you very much. We have another question from the audience. What other medications are effective for fibromyalgia aside from Lyrica and Cymbalta? For example, gabapentin and low-dose naltrexone.
Yeah. So, so they mentioned pregabalin and duloxetine are the two drugs that are approved in Canada for the treatment of fibromyalgia. For those of you who used these two drugs, you probably know that even taking these medications, the symptoms of fibromyalgia don't just disappear because you're taking those drugs. So what's the purpose of keep taking these medications if you're not cured of the symptoms? They are a little bit better, especially sleep and mood are the ones that we see improving with, especially with duloxetine, because duloxetine has a antidepressant aspect. So when the person is have fibromyalgia and depression, I prefer duloxetine. When the person has fibromyalgia and sleep problems, not a lot of depression, then my first choice is pregabalin. The other medications, there's another one that is not approved for fibromyalgia, but it's used over off-label is the antidepressants, tricyclic antidepressants, amitriptyline, nortriptyline. They also have, the same kind of benefits. They help with sleep, they help with mood, and reduce the burden of fibromyalgia. Now, the other ones, low dose naltrexone, and what else, Trudy? What was the other thing that they were asking?
Gabapentin.
Oh, gabapentin. Yeah, gabapentin is very similar to pregabalin. Okay, so anything that pregabalin does, gabapentin does very similar. So the same thing. Now, low dose naltrexone is the new, it's a new attempt. It's an old drug. It's not a new drug. It's an old drug that we know for a long time. It has been used for treatment of alcohol addiction. And we know that in low dose, because there are some clinical trials, about 4 milligrams a day, that has helped a little bit with the symptoms of fibromyalgia. The problem is that in Canada, especially, the tablet of 4 milligrams doesn't exist, because this medication is used for alcohol use disorder. And so the lowest tablets are 50 milligrams. And if you give this to someone with fibromyalgia, you're going to make them suffer a lot of side effects. So the pharmacist has to take that tablet, transform into a powder, put into a tablet, measure the 4 milligrams, and create the tablets that are 4 milligrams. And because this involves the handling of this medication, they charge a lot of money. So this becomes very expensive. I had some patients of mine that tried this route. I'm not super excited about it. I didn't see a lot of, this is made a big difference in my life. It didn't make that big difference. About the same effect that we see with duloxetine or pregabalin. Yeah.
Oh, thank you, Dr. Furlan. And that's the end of the questions. Fibromyalgia Association Canada would like to thank you all for coming to our event. Together, we can raise our collective voice. FAC wants to especially thank Dr. Furlan for taking time away from the Canadian Pain Society's pain conference she is attending in Montreal, and for her continuing support with fibromyalgia, for support of those with fibromyalgia and FAC. I would also like to thank our two moderators, Salima and Maggie, and Mario, for our technical support. Thank you, and enjoy the rest of your May 12th.
Thank you.
Thank you, everyone.